Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Quality. So this is the predominance emotional state at a particular point of time. So the abnormalities of quality, it includes the elevation of the mood, there is the dysphoria, they can also be the depressed of the mood. Next is the elevation of mood. The elevation of mood, you have the euphoria, that is a state of extreme happiness. So extreme happiness can be seen, that this is no reason. So this is euphoria, extreme happiness without no reason, and the euphoria is seen in case of the mania and the hypomania. Now what is elation? Elation is a state of the euphoria and there is an increased psychomotor activity, of the psychomotor activity, and that is the PMA, and it is seen in case of the mania. Next is exaltation. Exaltation is nothing but the euphoria, and along with that they have a PMA, that is a psychomotor activity, and there is a delusion, the delusion of the grandiosity. Next, it is seen in case of mania as well as a hypomania. Then comes the fluctuations. The fluctuation in the affect and the mood. So there is labile, that is the unstable mood, and this will refer to the predictable. So this is refers to the unpredictable, uncontrollable. So unpredictable, uncontrollable, as well as the rapid shifts in case of the emotions. So in fluctuation, the emotions are totally unstable. Example, a man coming to the OPD and he is laughing at one moment as well as he is crying on the other moment. So this will be a good example, and it is seen in case of patients of the mania. Next is affecting the flattening, the flat effect, as well as the emotional blunting. So, or the blunt effect. There is an exact opposite of the labile mode. So exact opposite of the labile mood. The example is when you are cracking a joke, the patient does not laugh. So not laughing on a joke. This will be the affect flattening. And this is also seen in case of the schizophrenia. Then moving on to the appropriatedness. So appropriatedness. Here whether the emotional state is matching or in case of sync, if they are matching or in sync with the external environment. Now if it is in sync, there it's called, the effect is in appropriate state, and if it is not in sync, it is known as an inappropriate state. Next is the congruence. Congruence means it is more of an internal comparison, whether my emotions are matching with the thought or the content. So it is matching with the thought or not. Then looking at the axithymia. Axithymia is difficulty in recognizing and describing the emotions. So describing emotions you find very much difficulty. It is in distinguishing the emotional and the physical. So describing the emotional, distinguishing the emotional and the physical perceptions, and lacking the external oriented thinking. This is lacking. Then moving on to ahedonia. Ahedonia is the inability to feel pleasure, and this is inability to feel the pleasure that is previously pleasurable activities. So the feature of depression. Then it can be also seen in case of the schizophrenia. To learn and grow daily like this, please do subscribe.